So for today, we'll be discussing the infant respiratory assessments. So our procedure for this would be, of course, automatic. We need to do the hand washing. Then we need to identify the patient. So if the baby will be beside his mother, you need to check, or you need to do the counter checking of their ID bands. Then assess, of course, the infants. So how are we going to assess for the infant? You need to do the ABCDE approach. So ABCDE stands for the airway, the breathing, the circulation, the disability, and of course the exposure of the baby. So how are we going to assess for the airway? So we need to ask these different questions in ourselves, of course, because we will be doing the assessment on the infant. So is there airway patency? So are there any signs of airway obstruction? So with regards to obstructions, the secretions that the baby is having is also considered as one of the airway obstructions. So in that case, if there would be a severe or more secretions to the baby's nose or throat, you need to do the suctioning. And another thing is the patient making noises? So you will be hearing noises like the stridor or the snoring. And is there any neck swelling or bruising? Then another thing is assess also for the breathing pattern of the baby. So for the effort, you need to check for the respiratory rate of the infant. You need to check if there is a nasal flaring, grunting, tracheal tag, or a subcostal or intercostal recession. So you will be seeing this one with the baby if there is a respiratory problem. So these common problems that I'm referring is, you will be seeing this one with a video that I will be showing you later on. So another thing is the efficacy. You need to assess for the air entry. You need to check for the chest expansion. And another thing is you need to check for the oxygen saturation. So by the way, with regards to the checking of the oxygen saturation, considering that the infant is experiencing respiratory problems, you need to check the oxygen saturation before doing the procedure. Okay? Then the effects, assess for the heart rate as well, the skin color, and of course the mental status of the infant. And you need to do also the history taking. So how are we going to do the history taking? Of course, you will be asking some questions from the mother, of course, because the mother will be the one who knows everything with regards to her infant. So is there any medication that was given before with the infant? So is this a problem already occurred several times before the confinement? Something like that. And you need also to count for the respiratory rate for 1 full minute. Observe for the rise and fall of the chest. So for some of us, we have difficulty of counting the respiratory rate of the infant. So you may as well place your hand lightly on the chest of the baby and feel the rise and fall of the chest. So in that way, you can easily count the respiratory rate of the infant. And after that, you may now do your documentation. And if there would be problems like what we've mentioned, the nasal flaring, the tracheal tag, or the chest retraction and everything like that, you need to refer that one to the attending physician. So in the absence of the attending physician, you might as well refer that one directly to the resident on duty or the junior consultant. Now, what if the infant has respiratory distress? So when we say infant respiratory distress syndrome, or the IRDS, this happens when a baby's lungs are not fully developed and cannot provide enough oxygen, causing breathing difficulties. And usually, this affects the premature babies. And this one is also known as the newborn respiratory distress syndrome, or the hyaline membrane disease, or the surfactant deficiency lung disease. So as you can see from the picture, this one is an example of the respiratory distress, wherein upon assessment there is a retraction and of course the grunting of an infant. So what are the common causes of respiratory distress? Of course, there is our upper respiratory infections such as the croup and influenza, and the lower respiratory infections such as pneumonia and bronchiolitis. And another thing would be the bacterial infections such as bacterial pneumonia or the tuberculosis. And another possible cause is the allergy or the asthma. Sometimes this kinds is the familial history. Is there you need to ask this one also from the mother. Is there any history or from the family that having this kind of allergy or asthma? Because most of the time the baby will also be acquiring the same kind of illness. And another thing would be is the tobacco smoke. So during her pregnancy, the mother is having this kind of vices like the tobacco smoking. So in that case, that will also give an attribute or will also give this kind of disease to the infant if she will be if she's been with the tobacco smoking. And another cause also, possible cause, is also a foreign body inhalation and the genetic conditions such as the cystic fibrosis. So what would be the symptoms of the IRDS? Of course, there will be an increase in heart rate and of course the respiratory rate. So knowing that you have noted that there is an increase, so as nurses, you should also know the normal values for this kind of vital signs. Then there will also be a color changes, which is the bluish color around the mouth or the fingernails or the fingertip of an infant, and the pale or gray skin of an infant. And there is noises such as stridor, wheezing or grunting. And there will also be nasal flaring, chest retraction, sweating, and of course, knowing that there would be difficulty in breathing, there is also use of the accessory muscle. And another two is the sternocleidomastoid contractions, and automatic, there will also be changes in the conscious state of an infant. So what would be the possible treatment for this kind of disease? Of course, there's a need for surfactant replacement therapy, and knowing that the patient is dealing with the respiratory ailment or the difficulty of breathing, of course the infant will be needing more oxygen. So if in case that the baby has difficulty of this kind, so he needs breathing support from a ventilator or the nasal continuous positive airway pressure or the NCPAP. So as nurses, if you have this kind of cases that you will be handling in the hospital, if you have this kind of diagnosis, please be prepared, because if in case that there would be fold or very much low saturation of an infant, the oxygen saturation, please be prepared for a possible intubation. Okay, so prior to the ventilator hooking. And another thing would be medications prescribed, of course, by the physician. So automatic, there will be an antibiotic in that kind of diagnosis. Okay. And of course, another thing is not only antibiotic, there will also be steroids, knowing that there is a difficulty of breathing. Okay, then another topic for today is also the seizure or the fit or the convulsion. So this one is potentially serious medical event which occur when the brain is suddenly flooded by abnormal electrical transmissions. And the common actually seizure that we've encountered for an infant is of course the febrile seizure, wherein it occurs because the brain is not mature enough to deal with the body's high temperature. So meaning, if you receive a newborn or infant with high fever, you need of course to do the you need to instruct the mother to do the tepid sponge bath. If the mother has no knowledge with regard to tepid sponge bath, you might as well educate the mother. Aside from the fact that we'll be also giving medication for this kind of illness of an infant. So we have different types of seizure. So actually we have two types, general type, the focal, and of course the general seizure. Okay, but this I reiterated the different types, okay? The subtypes of seizure, which is the tonic seizure, wherein the parts or all of the infant's body can stiffen suddenly, okay? Then myoclonic seizure, it is a group of muscles in the infant's body. We also start to jerk in clusters, okay? So in group, several times and for a few days in a row. So what would be the specific parts that you will notice? Of course, the shoulders, the neck, or the upper arms of an infant. And another type of seizure would be the febrile seizure, wherein the infant's limb may either stiffen, jerk, or twitch, and their eyes may roll. Okay? And of course, knowing this one is a febrile one, there should be a high fever noted. Then a tonic seizure, wherein the infant may suddenly go limp and unresponsive, as in dropping their head suddenly or falling suddenly to the floor while crawling or walking. Another type is the absence seizure. So absence seizure is the short episodes of staring into space, okay? Then blinking their eyes quickly or moving their mouth as if chewing. And the focal seizure naman, is the spasm or rigidity in one muscle group. There would also be pale, sweating, vomiting, screaming, and of course crying, gagging, smacking their lips, or becoming unconscious. And there would also be infantile spasm, wherein there is a stiffening of the arms and legs, bending forward, and arcing of the back. So these are the common types of seizures. So as you can see, most common is the jerking and of course the twitching. And sometimes there is a blank stare, the bobbing of the head, like that. These are the different kinds of signs, different signs of seizure, wherein sometimes they mistakenly identify this one as not seizures, okay? So if in case that the mother had experienced this kind of movements of his infant, please instruct the mother to observe the baby thoroughly. And if in case the mother will ask for help, that she reported it to you that the baby has having this kind of movement, as a nurse, you need to observe thoroughly the movement, the signs, if it's really a seizure that is occurring with the baby. Okay, so what would be the causes of this seizure? Of course, the possibility of brain damage from illness or injury, brain bleed or hemorrhage, and of course, brain tumor. And another thing would be the infections such as meningitis, encephalitis, and of course, the high fever. So as you can see, all of them are causes which comes from the brain. The affected part is the brain. Okay, so if in case that the infant is being admitted has a history of fall, you need to observe that one for 24 hours. If there would be fluids coming from the nose or from the ears after the incident, or is there a sleeping pattern that is very much abnormal? I mean, is there is a long sleeping hours of the baby, which is different from the routine sleeping pattern of the baby before. So those are the things that you need to observe if the baby has this kind of encounter like having a fall. Okay, so what would be our nurses task in encountering, in having this kind of illness or incident? Of course, you need to you need to think first the safety of the infant. So if in case that your patient or the infant is having a seizures, you need to put the side rails up and make sure that there are pillows placed or soft padding around the child, so that if in case that the baby is having jerking or twitching movement, his head will not be bumping on the side rails. It will just bump, of course, with the soft padding or the pillows that you have placed in between or surrounding the infant. Then note also the time. and duration of the seizure. Okay? Then immediately call the physician. Then do not restrain the infant. And if seizure stops, check the airway or the breathing, then the heart rate, and of course the temperature, meaning the vital signs. And please also include the oxygen saturation of an infant. Then if with fever, cool him down, do tepid sponge bath, and remove clothing. And do your documentation. Then, of course, knowing that you've referred this case to the doctor, you need to carry out the doctor's order as soon as possible. So that's it for today. So I'll be posting the different videos with regards to the seizure and of course the respiratory distress syndrome sign, the different signs of respiratory distress, for you to have an idea on how are you going to refer the infant if in case that you'll be encountering this kind of diseases. Okay, so thank you very much and hope to see you next week.